Welcome to It Depends, the podcast for therapists by therapists. I'm your host, Dr. Joy Zolakowski, and this is the place where nuance lives. Each week, I sit down with a fellow mental health professional to talk about the lessons we wish we knew when we started, the clinical moments that changed us, and the wisdom we carry now. This isn't a how-to, it's not a highlight reel, it's the honest, messy, meaningful conversations we don't always get to have. Whether you're just starting out or decades into the work, you'll find real talk, shared humanity, and space for the questions we all come back to. What's the right answer? Well, it depends. Let's get into it. This week, I'm meeting with Sarah Bateman, an LCSW and psychotherapist who specializes in eating disorders as well as depression and anxiety. In addition to her work in private practice, she is the REN while working to raise awareness of eating disorders in the Jewish community. Alrighty. So today, everybody, I have Sarah Bateman with me. I have become familiar with Sarah through Renfrew and through the JEDPRO conference, which will be happening on September 5th. And she has been kind enough to join me and let me pick her brain about all the wonderful therapy things that we work with all the time. So, Sarah, I would love to hear your story. Like, how did you become a therapist?
Okay, thank you. I'll just quickly introduce myself. I'm a licensed clinical social worker. I have a private practice in Teaneck, New Jersey, and I've been with the Renfrew Center for a long time, since 2009. I don't know how many years that is now, but started out as a clinician in the Manhattan site, and we were seeing a lot of Jewish patients, Orthodox Jewish patients. And I originally got my job because they specifically wanted somebody who could work with the Orthodox patients who were coming in. I think a lot of Orthodox practitioners, people in general looking for any job, worry about when to reveal that they keep kosher. And I like to share that I got my job when I said I keep kosher. So that was pretty cool. I really wanted to work at the Renfrew Center. I was able to get an informational tour when they said they had no openings. And when they showed me the kosher food and I said, oh, I love that restaurant. They said, oh, you keep kosher? And suddenly there was an opening. So I love telling that story because it's the opposite of a lot of people's experiences. After working there as a clinician and with the Orthodox clientele, we realized that I was actually making people who were Jewish and not Orthodox feel excluded. That was a big aha moment when somebody came up to me and said, well, can I come to your group even though I'm not Orthodox? I observe Yom Kippur also, and I'm nervous also. And it was like, wow. So went back to management. We changed my title from Orthodox Jewish to just Jewish, and made sure to just try and be inclusive and respond to all the different needs. And that was a huge learning experience for me. Just trying to work with the different nuances within the Orthodox community was a lot. Switching over to trying to not make anyone feel excluded and respond to everyone where they were was, I think, a really important change. And then after several years in that position, transitioned into my private practice, but stayed on with Renfrew as a consultant and liaison to the Jewish community. So I do staff training for clinicians around the country. We've created questionnaires and kind of just how to get the conversation started so that anybody at any site with any background knowledge, whether there's one or two, or whether they're familiar or not, can kind of just get the conversation going, ask the right questions. And go ahead.
In your private practice, do you also work with mostly Jewish clients?
It's very mixed. It's interesting because I'm in Teaneck, New Jersey, which is a very Jewish area. But, I think right now I'd say it's 50-50, and it goes through waves. It changes. I specialize in eating disorders, but I see people with depression and anxiety and people who don't have eating disorders as well.
I feel like that's a very typical caseload for most eating disorder providers. We do this, and then we also have a little smattering of everything else.
Yeah, for sure.
Do you get that? Do clients ask that question a lot? Like, can you see me for other things?
Yes, but I've been asked that, but I think more often I have on my profile in Psychology Today that I specialize in eating disorders, but that I also work with depression and anxiety. So I think they have seeked me out knowing that I do other things. And I think it's more of a surprise for me. when people come to me who don't have an eating disorder. Even though it's a large part of my practice, I'm still surprised when, knowing I have this one intensive expertise that they are seeking me out for other things when they don't. But then it does come out a lot of times that might have been some of what attracted them. They don't have an eating disorder, but they have struggled with their relationship with their body or with food and thought it'd be nice to have that touch, I guess, in their therapy.
Yeah, I find, and I don't know if this is your experience, but I found in the field, there seems to be more of an emphasis on like specialty work. It used to be that you saw one therapist and the one therapist did everything. And now I'm getting clients who have a trauma therapist. They have an eating disorder therapist. I think those things are wonderful. And especially to have somebody so focused on a particular niche does often mean you get some better experience. But I get a lot of questions of, I want to talk about something outside of my eating disorder. Am I allowed to do that? Are you trained to provide that?
Yeah, I'm very open if I ever don't feel like I'm equipped to deal with something, and I'll give any kind of disclaimer for their benefit. But yeah, I think that mentality might come from more of a short-term focused therapy of, we want to be really solution oriented. I'm dealing with this problem, want to take specific steps to work on that, not really looking for somebody who can just look at them as a whole and deal with all the issues. So I think sometimes there will be things that I really feel like are out of my scope and I would want to refer them out because that would be a disservice. But definitely if people are coming and want to talk about other things, I'm going to do my best to look at all their issues and respond to whichever needs they're bringing in.
So you mentioned that you took the job at Renfrew, and did you know that you wanted to specialize in eating disorders?
I did. When I was in high school, many of my friends had eating disorders. It was almost like the norm, and I didn't. And I'm open about sharing that I didn't, but kind of became fascinated with the fact that everybody kind of knew it was really known, and yet nobody was talking about it. So I felt like I had a good relationship with food. I had a normal relationship with my body for, a female in America that's, we all have our issues, but pretty good, and felt like, I could help, I could talk. And yet here, there was no professional trying to help my friends. I wanted to help my friends. And this even when I was in college, I met somebody who had gone to my high school who was a year or two older. And when she found out how old I was, said, "Oh, you're from the eating disorders grade." So it was like one of those like, wow, this is like really a thing. So I kind of got in my head. I knew I wanted to be a therapist. I can't even explain why. I was always interested in psychology. I loved it. Ended up going the clinical social work route to become a therapist, but knew that I loved psychology, wanted to be a therapist, and really just became clear to me that this was the work I wanted to do.
Yeah, I'm just curious. Did you go to Jewish day school? Because I had a very similar, we had our eating disorder grade too.
Okay. I guess it really is a thing then. Yes.
It's wild. But some of my peers suffered with eating disorders, but the grade 2 below us they were in really bad shape. They really struggled with mental health, but particularly eating disorders.
Yeah. Yeah. So definitely, like I said, it seemed to me like it was something that everybody knew about, but nobody was talking about. And we had different professionals come into the school talking about the different issues. We obviously had drug prevention and alcohol prevention and some really excellent trainings over the years. So it really, I got the idea in my head that this is something that we need to be talking about. And I'm really, really happy to say I go into schools, I talk about it, I talk about it in the community. And a lot of people, even 15 years ago when I started going into schools, they wanted me to speak about the issues without even using the word eating disorders. When they first started having me come in, I had to be careful what they would allow me to say. And I would say it is wonderful that I've seen such a change. But I think it also, that's the outreach has been a wonderful piece. And then being able to see people individually and feel like, the stigma has really changed. That's what I'm trying to say is that I feel like we're not afraid to talk about it anymore. And it's not shameful to come get treatment. And parents are recognizing it. Schools are acknowledging it. And I've really seen a huge shift in our community.
I don't think the stigma was quite the same in my school. And I'm also curious. I went to a pluralistic school. What denomination was yours?
Orthodox.
So I wonder if there's some subtle shifts there in which communities are a little more, I wouldn't say they were
Mhm.
open,
Mhm.
but it wasn't as taboo.
Yeah. I mean, I think it was avoided more than anything. And then when they first started acknowledging, it was with some, whether it was shame or worry about how parents will react. One of the schools I spoke in, the principal went up and I said to the whole school, people think that the fact that we do this program every year means that we have a bigger problem. And we think it's the opposite. The fact that we're talking about it means that we don't have to have as much of a problem. And that very much guided me. And I have quoted that going into other schools, just having this fear to talk about things does not create less of an issue. If anything, it can create more of an issue. So definitely seen a shift in my community, at least.
I've seen a shift in the larger eating disorder community as well. Like I remember when I started, I was also at Renfrew, and they have grown so much. Their kosher meals at the time were just TV dinners that were kosher. There wasn't a ton of, there was thought and effort put into it in the sense that they were even thinking about that, which
Right.
I think was a lot sooner than a lot of other people were
Right.
addressing
That's
it
the
at
whole
all.
thing.
But it was hard because it was unappealing for the girls.
Right.
They get a TV dinner while everybody gets something that looks a little nicer.
Right.
And it was so isolating.
Sure. And yeah, I mean, even now it's going to depend on the site and the availability and what they can do. When people come in, that's some of the work I still do as the liaison. It's just what food can we get in? What can we accommodate? How can we make this work so that it's not a painful experience? Because we want recovery to be sustainable.
Yeah. And I want to give them like mad props because at the time, and other people may have been doing it, but as far as I know, they were the only ones who even offered an Orthodox track for folks. And it's so cool to have seen them grow in the way that they have.
I agree.
So, one of the things that has been really interesting to me as I've started this podcast is how are you different today? Like, what did you learn in your training or your original practice that has significantly changed for you?
I mean, there was one thing when I first started working at Renfrew. I remember we used to kind of, if we asked people how they were feeling and they said they were feeling fat, we were kind of trained to respond that fat is not a feeling.
Yes.
And later on, this is years ago already, but I remember kind of just relearning this whole mentality of that is so dismissive. And rather than saying, no, the way you're telling me you're feeling is not a feeling, that's actually really dismissive and demeaning and can shut somebody down. Instead, let's understand what are all the feelings that go into what you're feeling when you say that you're feeling fat. And that fat is actually so many feelings. And it's an excuse for so many emotions that we don't know how to name and we don't know how to voice and we don't know how to go through and experience. So, when we say when a patient used to say to me that they were feeling fat, 20 years ago, I might have responded, well, fat is not a feeling. What are you really feeling? And now I know that is actually really dismissive. And, one of the things I've learned over the years is that we cannot validate our patients enough sometimes. Another thought that stayed with me once, I was in a training that she said, validate the hell out of them. And if you think you're validating them enough, validate them more. And, we had to kind of just like play ourselves back and see where we thought we were being validating and validating an emotion, and it wasn't enough. So that's something that's really changed specifically in my response with eating disorders, that is a feeling. It can be many feelings. It can be many words. It can be many needs, unexpressed emotions. And so rather than dismissing, let's go deeper and let's break it down and let's validate.
We're saying that exact thing to clients so many times. And likewise, I don't do that anymore. And we have a very similar conversation,
Yeah.
but I
It's nice that we can grow, right?
I hope so.
I hope so too. But yeah, it's nice when we learn something about, and can kind of unlearn what we thought we knew.
So, and this may be a little specific to eating disorders, but everyone's an eating disorder clinician right here. How have you seen the field change?
Well, I know specifically with the Renfrew Center's unified treatment protocol, I've changed the way I practice. And, it's rather than just constantly pulling from different modalities of what might be helpful. We have a really manualized treatment now. Anybody can buy this manual on Amazon, but it's really guided my practice in a different way. I've taken these trainings so many times. I've given these trainings so many times. I feel like I go deeper with my understanding of how to go deeper every time of just, I hope I'm making sense, but just this idea of helping our patients learn how to go through their emotions and us sometimes going through it with them, that it's not about us as a therapist, but we're humans and we're in it. And it does have to be a good fit. It has to feel like, they have to trust us. We have to feel like we can help them. There has to be a relationship to some degree, even though it's different than a relationship outside of therapy, but it's given more, I think, more structure. And I think it's helped me. I think I've always had the belief that recovery was possible, but it's helped me convey that belief better, if that makes sense. I always felt like if I didn't believe people could recover, I would not be doing this work. But it was, harder to explain that versus we have this evidence-based practice and this actually works. And I've seen this work and it's working faster and it's working better. And these are tools that you can really pull on. And they might be things that but you didn't realize were tools because, it might be so obvious. You might not think you're learning something new, but if you didn't know that you can pull from your knowledge and use that in the moment, then you weren't using the tools you had. So
sure.
It's definitely given a wonderful framework for practice.
And
I
you
think a lot of
mentioned,
people are using it. Sorry, go ahead.
no, I'm sorry. You mentioned the relationship. And one of the things that's come up in supervision with my baby therapist is how do we know when to self-disclose and what those boundaries look like in therapy?
Great question. For me, it's very clear. Self-disclosure should always be for their sake, not yours. And I will play something back in my head and I will ask myself, do you want to say this right now? Or do you think it will be helpful for them? And that question, sometimes slowing down my own thoughts, it's not a conversation. It's not a back and forth. It's their time. So do I think that this will be helpful for them if I share it? And that is the only time that I will self-disclose, not for my benefit, not to have a back and forth. If I think that having some back and forth will be beneficial to them, then yes. But
sure.
I feel like they're trying to get to know me or they're asking me questions, I don't want to just sit there, oh, why do you ask? And kind of deflect. And it's, definitely as I've gotten more experienced and more comfortable in my own practice, I don't mind. I'm not defensive. I think maybe 20 years ago, I would have been like, why do they want to know that about me? Whereas now I don't have those same thoughts. I just will ask myself that same question I've been asking all along of, will this be helpful to you? And sometimes they just want to know a little bit about me to feel comfortable. And that is about them. And sometimes it's a simple question and I'm happy to just answer it. But I have to just make sure that it's not for my sake. It's always for theirs. And asking myself that question in my head before responding has really, really guided me. And just about boundaries also. Does that answer that or?
Yeah. And I was thinking about that because I met with a client this morning who somehow we were talking about self-disclosure and they said it has really helped that you humanized yourself to me. And it got me thinking about how I self-disclose with them versus how I do or don't with other folks, because this particular client needs to feel like they are in the room with the person. Mm-hmm. More of that blank slate just doesn't work for them at all.
That makes sense. Yeah, I definitely would not say that I think that's been, like I said, part of it is just age and experience. As we get older and we get more comfortable and we get more confident in our abilities and our own processes, it might just be easier. But I also, the fact that I have this guidance that we are part of the process and that even though it's not about us, that we are humans and that's okay. And we don't have to hide the fact that we're humans. Yeah. Some people just need a little bit of connection. They're not going to feel comfortable disclosing about themselves if they don't feel like we're going to hear them or get them. So I think that's really wonderful that your patient was able to say, thank you for humanizing yourself.
Yeah. It was a really cool moment to reflect.
Yeah. Yeah. And I think along the same lines, like, boundaries. I think boundaries for me, my core belief about boundaries and the importance of them has not changed, but my comfort with loosening boundaries in certain situations has also changed with, again, with time, age, experience. And again, with mindfulness, if I were to be put on trial for this, would I be able to defend my decision, But there's definitely been times where, based on the situation, I've relaxed the rules, it was a crazy heat wave. Was that last week, 2 weeks ago? And I know my office is air conditioned. I have a wall unit. Still doesn't get so cold in there. And I was thinking, it's going to be really hot for people coming in today. And I don't normally do this, but I brought a cooler of cold drinks. And I was like giving out drinks. And I'm like, is that, I'm not supposed to, I don't want somebody to come back because I brought them a good drink. That's kind of the rules we learned, but it's 101 degrees and everybody's going to be dripping sweat. And, I'm going to do that anyway. So that idea of, do we feel comfortable sometimes bending the rules? Or, I once squeezed somebody in right before a Jewish holiday, and she's also Orthodox Jewish. And she came in with fresh baked challah and baked goods for me and this beautiful platter. And, we're not supposed to accept gifts. That's an ethical boundary, right? And I could completely see why. But then there's also that human connection again. First of all, I've been seeing her for a long time. So I know, first of all, that that baking helps her anxiety, and that she's very OCD. Like, it helps her to just measure out. She's talked to me about measuring out the challah and putting it on the scale and making sure everything's really even. And then she made me this absolutely beautiful platter. So I'm like, in my head, I'm like, okay, did she feel like she had to because I squeezed her in? Will she feel like she has to next time? And, but I also know that she keeps kosher and it's clean. And yes, I did squeeze her in right before holiday, and this will actually be helpful. And will it hurt her feelings if I say no? And, so I explained, I'm not really supposed to do this. So I have to tell you not to do it again. But that said, this is gorgeous and looks amazing, and I absolutely appreciate it. So, just accepting a gift kindly and genuinely is also just really important sometimes, even though we don't want to set that precedent of, I think it would have been much worse to say, no, I can't take that.
Mm-hmm.
And it was absolutely delicious, but definitely can't ask for that again. But I think that's a great example of just loosening the boundaries and feeling comfortable going with the process of what happened. She felt like she had to. I let her know she didn't have to again, but she wanted to know that I appreciated it, and I did. So relaxing a little bit.
You walking us through the process, because I think sometimes we hear these rules or boundaries, and then somebody does something different, and we're like, but how did you get there? And the process makes so much sense to me, right? Like, you were thinking about the client. They use this as a coping skill. So it was something that helped relax them, and they were showing gratitude, and you had a conversation about it. It wasn't just, oh, thank you. Like, we never talk about it again. It's
right.
And I think that's sometimes what's missed by outsiders, just how much thought goes into all these different decisions. It's not just accepting a gift. It's what else comes with it.
Right. And how hurtful would it be to not accept the gift as well?
Exactly.
What would the damage be from that? But yes, I like how you put that, of just going through the process, and a lot of thought does go into it.
Because there are some times that I have absolutely not accepted a gift. And it was the same process of, I think this means more than just they're giving me a platter of baked goods and maybe to say thank you, or maybe because this is what they do normally for people in their lives. And so really
curious.
having to
Can
go
you
through
share?
that. There's someone I worked with a million years ago when I was in college counseling, and I don't even remember the gift, but they had expressed that they had some romantic feelings, which we had processed and is totally normal. And it was fine. Everything worked out well. I continued to see them as a client, but the gift, I was like, I'm not sure what message this sends if I accept it. So I'm going to not talked about it. And again, it was fine. I think they just wanted to give a gift. There was no nefarious intentions behind it.
Right.
And then
I totally can hear why you didn't and why that didn't feel comfortable. So that's cool to see those two opposite examples.
And I've had plenty of clients who very similarly have come in around the holidays, or especially when we're ending our time together. My adolescents have always liked to give a little memento, and I still have them. I have a box full of all of those things because they're really special and important. So it's
definitely have a box of cards people have sent. And I also hold on to those.
I have a scarf that someone actually made me from Renfrew. It's a black and
Oh,
hot pink scarf. And it's a little too short to wear. It was one of their first knitting projects, but it sits with all my box of things. And, I remember the client and everything about them. And so it's nice
wow.
to look at those things and remember that.
That's nice.
This September, a first of its kind event is bringing together professionals who understand the intersection of eating disorders and Jewish identity. Introducing the inaugural JED Pro Conference, the Jewish Eating Disorder Professionals Conference, happening virtually on September 5th. Join clinicians, dietitians, educators, and researchers from across the country for a day of insight, connection, and culture-informed care. Whether you're Jewish, work with Jewish clients, or want to deepen your understanding of faith and identity in the eating disorder treatment, this conference is for you. With expert-led presentations, community discussions, and a shared mission to improve outcomes in the eating disorder care. This is more than a conference, it's a moment. Registration is now open at jewisheatingdisorderprofessionals.org. How do you approach supervision and mentorship? Is that part of your career? Right? Well, you do trainings, so I assume there's some kind of
Yeah.
education supervision that goes on as
I have a peer supervision group where it's just amazing because we can just run when we are unsure, when we don't know how to proceed, we can run it by each other. And we take turns bringing cases, but we'll change that based on need if somebody needs to talk about something. And yeah, definitely had a situation. There was one time where I wasn't sure if I should be calling CPS, Child Protective Services, or not, and the group felt like guided me that I should. Again, that idea of just, could I defend this decision if I needed to, really
Mhm.
helped guide me. But then had people also saying, absolutely. And I think in our training, they always kind of tell us that if we're not sure, you should call, you can always ask. And, this particular example stayed with me because it kind of felt like it really backfired and wasn't the right call.
Do you feel
And
comfortable
that,
sharing?
that can happen. I know I've seen that happen with other clinicians when they've called. I've seen just when the parents just retaliate and they're so angry. And I don't blame them because it's such a sensitive situation sometimes. This was for the client that I was talking to, this was about somebody else. And then her parents were very upset that I didn't speak with them first. So there were multiple people involved here. And so, even though my peer supervision, I felt good that I ran this through other clinicians and knew that I had people
Mhm.
who would support me and could remind me why I made the decision I did. Because a lot of times, again, if we have to defend our behaviors or we're going to go on trial, we want to make sure we kind of have reasons that are valid or concrete and that we can stand behind. So I do, but a lot of times it's still not, things are not black and white. We talk about that in therapy. It's not always black and white. There's gray area and people can get very angry, retaliate. Yeah. And sometimes what we think is best does not always feel best. Sometimes it's still the right thing. Sometimes we want to be able to feel good about what we did or what we said at the end of the day, even if the results are not what we wanted. Yeah. I just went into a whole tangent, but that was
It's
my thought about just
important.
ethical dilemmas with supervision when you asked about.
No, it's an important one though, and I think a lesson that most of us encounter at some point in our career, that even if we do the right thing, the ethical thing, the legal thing, that doesn't mean it's going to go the way we'd like it to. And sometimes that will end a therapeutic relationship. Sometimes we can repair it. But it could kind of blow up in those ways. And it's the icky part of like, I know I did the things I was supposed to do,
Right.
and
Right.
this went really wrong.
Well said. You summarized that perfectly.
But I've had a similar situation, made a call to, we're in Connecticut, so it's DCF. And there are certainly things I could have done differently. Like I probably should have spoken to the parents before I made the call, but I got supervision first and I kind of had waited till the end of the time limit to make the call. So I just got to make this. And I did call them afterwards, but they ended therapy with me, didn't go well, and the call still needed to be made.
Yes.
So it's really hard to sit with those things
Yes.
sometimes.
Yeah. So you get it. And I think we all have those moments. And, it's also accepting that it's not always going to feel good.
Yeah.
We'd love to focus on the successes and the positives, but sometimes we have things that don't work out the way we wanted them to and leave us not feeling great. So I think that's important also to acknowledge. That is the reality of our work sometimes. Definitely, we don't always get to wrap everything up neatly in a box.
No.
No, I know that when I was a new clinician, that was what I wanted to do. I wanted every session to be wrapped up neatly in a box. I wanted there to be a purpose to every single session and that we could summarize it at the end and wrap it up. And it's really hard to do that in 45, 50-minute session.
How did you learn to tolerate that?
I mean, that's exactly the word I would have used. I had to learn to tolerate that. One thing I did, and I do in my practice now, is I do 50-minute sessions. I think that the billing code is for 45 minutes. I feel like those extra 5 minutes just really, really matter. And if we're not going to be able to come up with a theme or a wonderful outcome for every session, we can use those 5 minutes to wrap it up anyway, that it sucks that we didn't get anywhere, or maybe it feels like it sucks that we didn't get anywhere. But sometimes venting or talking it through or not getting anywhere is part of the process to get somewhere. And so I really, I time my sessions so that I always kind of have that extra 5 minutes to wrap it up, but have a full 45 minutes for the session. Once I learned to accept that, I probably was better able to help them manage their disappointment for a session that doesn't feel good. And once I could accept that, I think easier to help them tolerate it. And once I know that I'm helping them tolerate it, obviously I can tolerate it better. To not feel like it was a disappointment and not feel like we didn't get anywhere. And also just really having the knowledge that just because it doesn't feel like we got anywhere just now doesn't mean that we didn't. We just might not know where we got yet, or we might have to process more.
I like the way of phrasing that, of like, just because it hasn't been wrapped up neatly or we haven't gotten to like a conclusion doesn't mean that we didn't do work. There's a reason that we talked about the things we talked about today, even if we don't know what that reason is yet.
Yeah. It's not part of the process.
Yeah. So we've talked a lot about like change and growth.
Mhm.
I'm wondering, is there a mistake or like a failure at some point that was a learning moment for you? Failure is like a harsh word. I don't love it. Maybe more mistake.
I mean, I remember when I learned that FAIL is an acronym for First Attempt in Learning. That was great for me. Have you ever heard that? I love that because it's tolerating failure was always a challenge for me, and learning that helped me, just looking at people who can just pivot and go in a different direction and find the next and thinking of it that way. We have to learn. I mean, I think that CPS example I gave before was a pretty significant one for me. And I think, I really learned from it to, in that case, it would have been helpful to talk to the other set of parents first. And, but also that we can't beat ourselves up. Sometimes we do the wrong thing or what doesn't feel like the best right thing. And there's not always one right. There could just be the best that we know at the time. And like I said, I did run it by my supervision group, had support on this. And yeah, I think failure can be a harsh word, but I think learning to tolerate failure and learning and not beating ourselves up for mistakes. And the same thing I would tell my patients of just, beating ourselves up for what we didn't know is not helpful. What will be helpful could be forgiving ourselves, having compassion for ourselves for doing what we thought was best at the time. And, compassion goes so much further than criticism, and just, we might have those self-critical thoughts, but can we just notice them and let them go and find the compassion? Like, I did the best that I could for what I knew then. And, maybe I wouldn't do that now. I know more now, and that comes with experience. For me, experience is huge. I've always felt like my confidence is built on my experience. I think some people will just walk in and feel confident right away. And I think for me, looking back over I don't know if it's 20 years of practice, something like that.
When you start to go back, you're like, oh, okay.
When you stop counting, you've been doing it a while. But that for me, true confidence is really based on experience and accomplishment and like I said, age, and just knowing that my beliefs might be the same, personality and goals might be similar from 20 years ago, but with age and maturity and experience, we're not going to be the same. And we're, hopefully going to keep responding better. But also, like I said, if one of the biggest changes is learning to forgive ourselves for our failures or mistakes or misjudgments, then that can just be huge in helping us pivot and go forward.
Mhm.
So for me, that's a big thing. Just not beating myself up.
I say to my clients all the time, it's progress, not perfection.
Love it.
And it's hard to remember that for ourselves sometimes because we're supposed to be the helpers. We're supposed to know
Mhm.
the right answer if that is something that even exists. And
Right.
so when we mess up, if it hits hard because it's like, I don't expect them to have all the answers. I do
Right.
expect me to be on top of
Right.
it.
Right. So just like it can be helpful for them when we humanize ourselves, like
Mhm.
also acknowledging our imperfections is important for us and important for us to be able to show that them sometimes, being able to apologize or being able to acknowledge what we didn't know or what we don't know. And, I think that that's important for us and helpful as therapists when we can do that. Sometimes
Absolutely.
we have to model recovering from a mistake and we have to we have to model the forgiving ourselves so that we can, especially if it's hard for us, it might be more important.
I think what's hard too is when the mistake does ruin the relationship. And then you feel like you've missed on this therapeutic experience of repairing the rupture, but it's also an experience for you of learning to tolerate that, yeah, you messed up and that's okay. And
Right.
now you
Right.
have to move on.
And being able to move on from the disappointment of not being able to always fix it.
Yes. Because I noticed that with so many of us, we're fixers, right? We want to help.
There's a
This is
reason we do
why
this,
we
right?
do it. Yeah. And so when you feel like you can't because of
Mm,
something you did, it
right.
feels gross.
Yeah. Yeah. My hope in those situations is that the next time they go to therapy or the next therapeutic encounter or relationship will be able to repair that and that they'll be able to go further with them because of the work or mistakes or shortcomings. So
Yeah.
that might be just one of those things I tell myself to make it better. But I do like to think that,
No,
it's all, like I said, it's the growth it's all part of the process. So even a mistake can be important in helping people grow.
So we've mentioned process many times, and there's that famous phrase, trust the process. What are your thoughts about that phrase? What does it mean to you?
Sometimes what's happening is what needs to be happening. We have to always prepare and come prepared, be prepared, and then be ready to let go of what we've prepared because that, I think that if we're not prepared, the process might not happen naturally. I think we always need to be, review and plan and prepare. But at the same time, like I said, be ready to let go of that, start where they are, be where they're at and go where they need to go. And so we can't always plan what the process will be. And, there will be times where we're not necessarily going in the direction that we need to go. That's when
Mm.
we have to kind of pay attention to what we're thinking, what we're feeling. I think one of the most important things I learned early on was that we need to pay attention to our own feelings and reactions in therapy. That I learned that if I am feeling bored in a session, it probably means that we're not talking about what we need to talk about. And that has really helped me redirect people, ask if that's what they actually want to be talking about. Or, I notice
Mm.
you're talking a lot about this, but you haven't brought up what you mentioned at the end of last session, just to really help redirect. So that's where the planning and the noticing and the preparation matters. But the process is what actually happens. And going with the flow and responding to the needs and dealing with what's actually coming up and still having some direction at the same time. It's not just like, let's just sit here. It's, like I said, we have to be prepared. We have to be going through our own training and our own introspection and our own part of our process is to have a plan and to have ideas and to have tools and to be able to provide those and then to also be able to respond to whatever they're coming in with each time and whatever they're going through and to be prepared. I can't come in and be like, okay, but we were going to work on these worksheets today and you were ready for tools. And they're like, hello, I just got in a car accident. Can you listen to me? That would not be helpful. The process is having a plan, being prepared, and also responding to the needs and the immediate concerns that come up. And also being prepared to pivot and change direction when things don't go the way that we thought they would go or wanted them to go. And like we talked about before, being able to let go when it doesn't feel like we did what we needed to do and we didn't get to wrap things up neatly with a bow.
I wanted to go back to something that you said at the very beginning. You had mentioned that you specialize in eating disorders, but you don't have the lived experience of an eating disorder, which is also something that I relate to as well. And I'm wondering how that has impacted your work with clients.
I think that, whether somebody has an eating disorder, has anything, it's not about what you've had. It's about, can you understand them? Can you help them? We don't have to, as clinicians, we don't have to go through something. We have to be able to help them go through it. So I've always felt like, my interest and understanding has guided my desire to do this as my profession. And I think a more interesting response to your question would be more that when I became a mom and ended up with three of the pickiest eaters in the world was when I got my real reality check. I think that I like to joke when people see how picky my kids are as eaters. I like to joke that, I started out as an eating disorder therapist, pretty confident that I could help people. And God laughed in my face and said, "Let me show you what it's really like."
It was like a
So
God's hold my beer moment.
I like to joke about this as part of my process of dealing with it, but it's almost funny to me. Like, I think of myself as, like I said in the beginning, I had a healthy relationship with food. I saw my friends struggling. I wanted to help them. And then all of a sudden, I understood that it's not that simple. And I think that it's just made me so much better able to have empathy for not only my clients, but when I'm dealing with parents of kids who are struggling. It can be really, really hard. And yeah, I could get caught up in how hard it is sometimes. And I do, because they're actually like, I have three super picky eaters who don't even eat the same picky foods.
Of course
And
not.
of course not. Yeah, most of the time I can get 2 out of 3 to eat the same thing. Yeah, like food is much more of a struggle in my home than I ever would have imagined it would be. Or if I didn't go through this, I don't think I'd be as good of a clinician as I am now in just having the understanding of how hard it is. And for me, not being dismissive of the problems and the struggles and the difficulties, because I, I really just like observed different people as they raise their kids. And I've seen, there are moms who are like, "Oh no, my kids aren't picky because I gave them choices." And I'm like, okay, it's really, really taught me that sometimes there's a match between the parent and the child. And when the way we do things works for our kid, that's really wonderful. But a lot of times, and this is something that's given me really insight into parenting and into my patients for just needs being met in general, that sometimes there's just a mismatch. The way your parents did things is not the way you needed them to be done. And the way your parents parented you could have been, they're not bad people. You're not a bad person. I'm not a bad
Right.
person. They're not bad. Nobody did anything wrong, but it didn't work. And so when there's a match between the two styles of the parent and the kid, and the food that was available and the food that's cooked versus what your preferences are and how you like to eat, great. Maybe it worked out, or maybe there's a predisposition and there's a mismatch, and there you go. But either way, end of the day, theories aside, it's definitely, I think I would have maybe been more dismissive than I am, less understanding, less empathetic, if I didn't see how much people can struggle. And to me, it just seems like it is biological. It is innate for some people. There are just different reactions and different attitudes. And yes, still learning all the time. But like I said, God was like, "Oh, you're going to get too cocky if I don't give you some more challenges. Oh, now let me help you be a better therapist. Let me show you." So that is what I joke about, but obviously with real challenges behind that.
When you're describing something that I think is so common, where so many parents blame themselves for their child's eating disorder behavior or mental health crises or whatever is going on. And not that we can't improve, because there are definitely some behaviors that I've seen from parents from like that
Mhm.
needs to stop. But it
Right.
also highlights this idea of we can do our best. We can be one of the experts in the field, and we can still be presented with this challenge that truly has nothing to do with bad parenting.
Right.
It's just how, lack of a better metaphor, how the cookie crumbled on that one.
Yeah. Yeah. And if you remember how I said earlier that like we just have to validate the hell out of them sometimes, like also just having that sympathy and empathy for the parents of, you
Mhm.
might be dealing the way that you've dealt with their eating disorder or their attitudes towards food in your household or the attitudes towards body is what you were taught and you didn't know any differently. And for us to be able to intervene effectively with the parents, we also have to have that empathy for them. And
Yes.
they only know what they can know. And they almost never want to harm their children or cause these issues. So just understanding that nobody is bad here and nobody's at fault, but can we shift the dynamic a little bit? Can we recognize how we might be encouraging the development or the push and pull, the need to perpetuate, if we can say it with empathy, we're probably going to get a lot further in getting them to help us help their kids and help themselves. So again, just understanding we all have our challenges and it is hard and everybody's dealing with something. And, if we just can go back to that idea of we don't always have the tools or know how to use the tools that we have. We don't always have the tools we need. And, can we just maybe shift the dynamic a little bit? And could that make a huge difference?
I think too, for a lot of my clients, it's been humanizing their parents. We, when we go back to like that object relations piece, we see our parents very often as good or bad objects. We don't see them as whole objects and people who are fallible and 99.9% of the time just trying their absolute best. And that doesn't excuse everything, but I think it provides some context and perspective of this is how we got here and how do we move forward. But it's hard to see them as a person. They're your parent. One of, I think I mentioned to you before we started, I like to do like a little rapid fire, which is either no pressure, like don't. It's not true rapid fire. It's just the name of the little segment.
Okay.
But these are just some standard questions, maybe some pearls of wisdom that we can give to other folks in the field. So rapid fire 1, do you have a favorite therapy metaphor? And if so, what is it?
Our feelings are always valid. Our behaviors are not.
Ooh, I like that one.
I repeat that all the time. I think it's really important for people to understand that while their feelings are always valid, their behaviors are not, and that there's a difference between our thoughts and our actions. And I will support any thought. You can hate them. You could be jealous. You can be beating yourself up, but then we don't have to follow up on that with our behavior and our actions. And, what we do is not okay. Hitting and being violent and lashing out. And also, I think it's just, sorry, am I explaining too much? Do you want to rapid fire more?
No, yeah.
No, I was just going to say, I think what goes into that also is just accountability. I think that, I will validate the hell out of you and how you feel, but I'm also going to make you take accountability for your behavior. And I think part of the process is also you understanding what you can do differently. How could you respond differently? How did your reaction, what's the ripple effect? If you want to change a dynamic, what can you do differently? And, how did what you said, or what you did help create that situation? Because that is something, here's another one I always say, we can't change other people, but we can change how we react to them. So that same idea of just our own accountability, I think, I will validate the hell out of you, but I will also make you take a look at yourself.
I really, really like that because there's so much truth to it. Our feelings are our feelings, whatever they are, but that doesn't give us carte blanche to act in certain ways in certain situations. We got to figure out better ways of responding.
And our feelings are always valid. However, sometimes the beliefs that are guiding our feelings are not true. And so sometimes we do need to look at the situation and we need to look at our beliefs or our perception of the facts that is guiding us, because while I would never say you have to change your feelings, you might have to change your understanding of a situation, and then you might have different feelings.
Yeah. So that perspective taking too. Do you have a favorite therapy book that has inspired you, guided you?
Not really a favorite book kind of person. No, I don't think I have a good answer to that one. I have a book. There is a book called The Untethered Soul. I don't know if you know that one, but that really... Okay. That's kind of like not a therapy book.
Well, that was my next question. Do you have a non-therapy book?
Okay.
So you're ahead of the game.
Okay. It's kind of about meditation, and it's kind of from, I think, a Buddhist perspective, but for some reason, sometimes something just clicks, helps things click for you in your brain. That book has really helped me understand how to help people work with obsessive thoughts. if there's just thoughts going around and around in your brain, how to just kind of notice it and let go of it. And the same concepts that we talk about in therapy, but from the perspective of meditation and peacefulness and being able to let go. So I've recommended that book to several people. But yeah, I have too many books. I can't think of just one therapy book.
It's the problem with therapists, whether or not it's a therapy book. I notice we all just have like 1,000 books. We're like, you should read this.
Yeah, yeah, and I'll definitely go through phases, and I like those workbooks, like the DBT workbooks, to giving people tools. I'll have people pull from different ones, and I'm blanking on the title. What? You should talk to someone. I loved that one. But yeah,
Yeah, I've heard of that. I have not read that one, but I've heard of it.
I've never been good with favorite questions because it's like favorite right now or favorite today.
I mean, hence the name of the podcast, right? Like, it depends. We're not
There you
static.
go. Thank you. I like it.
So finish the sentence. Therapists don't talk enough about.
It's weird because what popped into my head was our own therapy, except that I think we do. Maybe I just kind of want to say that as a reminder to therapists that we all need and deserve and can benefit immensely from our own therapy. I don't know if that made sense because I think most of the therapists that I know do talk about their own therapy, but that's all I could think of for finishing that sentence anyway.
No, I appreciate that because I think especially with the newer folks, I don't know how much they realize that their own therapy, their own continued supervision and consultation is so important. And I think we've also set them up. They're our most vulnerable group, right? They make the least amount of money. They're struggling to learn everything and get everything together. And then we have a system where a lot of the times they end up having to pay for their own supervision. So or their own therapy if they don't have insurance through their job, just reminding everybody how important it is and also acknowledging that that can be really hard to get sometimes.
Yeah. Exactly.
What is one thing or many things that you wish clients knew about therapists?
I think that, and then this is something I learned once, that it's good to let them know when we think about them outside of session. So I think the thing that they maybe don't know is that we do think about them. I think a lot of them like worry, you just take my money the 1 hour I'm here per week and that's it. And so letting them know that we do think about them outside of that. A lot of times they stay on our minds or we worry more than we maybe should. Judgment word, sorry. But yeah, but something I learned early on was that we should let them know when we think about them because it's really helpful. Obviously not like, oh, I was thinking about you all weekend and you're on my mind. That's not what I'm talking about. But when we have a specific thought or concern or a worry, and that does come up for us, that it's not only okay, that it could be helpful to let them know that something stayed with us or we came back to something they said in our minds or we thought about something differently than how we responded. And, it can be really affirming for them, but also helpful to let them know that we care about them. I think that might be what they don't always know is that we really do care. And so letting them know when we think about them can be really helpful and important.
I read a quote from Carolyn Costin recently, and she said, "You pay for my time, you don't pay for my care and support." And to a client saying like, "You're only here because I'm paying you to be here." And that really resonated with this idea of like, yes, we are compensated for our time. You don't pay us to care about you. We do that because we want to.
I love that. And I totally agree.
Yeah, that one really, I was like, oof, when I read that, like I liked that one a lot.
Yeah.
One last rapid fire. What is one word, phrase that you would describe your journey as a therapist?
Important. It's hard to find one word. A bunch of words fired in my brain really fast. Fulfilling and still going. But yeah, I guess I just landed on important because it feels like I feel like the work that I'm doing matters to me. I can't really see myself doing anything else. So maybe that's irrelevant.
We die in the chair. That's what I've heard from folks.
But yeah, I feel like I said earlier, I feel like people, it shouldn't be as hard as it is sometimes. And I feel like people really can get better and they can recover. And sometimes there's a mismatch and sometimes there's an unmet need, but that just learning tools or being allowed to kind of just untangle the thoughts in our brain. And sometimes it's just about venting and feeling heard. And sometimes it's about figuring out how to manage better or how to take accountability or how to be validated and all of those things. I do feel like I don't want to sound like I'm bragging, like the work I do is important. I want to make it sound like it's important to me that I do this work. So
Maybe it is okay if you brag a little bit too. I think the work you do is important.
with some appropriate humbleness. I would like it's important both ways.
I appreciate that. A nice way to put it. So those are all of the questions that I had for you. Is there anything that we didn't talk about that you're like, oh, I wanted to mention this?
Can't think of anything because like I said, I tried to not prepare. I didn't want to sound. I like to be authentic in these kinds of things, so I don't have anything in my mind that I would like to say. It was great to talk to you and just have a chance to process this.